Hey guys, Rena, Malik, urologist and pelvic surgeon here. Thanks so much to all my new subscribers who've joined in the last few weeks. Really appreciate your support. Today, I'm going to be reacting to another episode of Grey's Anatomy. So shockingly, there are a lot of episodes of Grey's Anatomy that have some sort of patient with a urologic condition. So good for me and hopefully good for you guys too, because it's kind of fun to do. So if you like what you see, make sure you smash that subscribe button and let me know that you're enjoying my content in a comment down below. Let's get going.
Hello, Mr. Samuels. I'm Dr. Edwards. It says here you haven't been able to urinate since yesterday. Let's take a look. Wow. It's no wonder you can't urinate. Your penis is quite swollen.
I think I got a bug bite.
That's a big bug bite.
It is more of a bee sting than a bug bite.
It's still pretty swollen for a bee sting. Do you have a history of allergies?
It wasn't really one bee, it was several.
Well, what's several?
I don't know, 25, 30?
30 bees.
I know, it's crazy, right? But see, it was Saturday and we had this hammock in the backyard and I thought I'd make some lunch, so I took my pants off and made a honey sandwich.
A honey sandwich?
Peanut butter and honey sandwich, because who eats a honey sandwich, right?
Right.
And I was eating the honey sandwich and I fell asleep and I guess I got some honey on myself and the bees caught the scent.
Okay. Well, I'm gonna get you a dose of IV Benadryl and a steroid. And then we're gonna get you a catheter so you can pee.
Dr. Edwards, would it make a difference if it were hornets?
So this happens a lot in urology. Patients will come in and they have done something during intercourse or for pleasure, and they come in and they make up a story that is clearly not believable. And I can totally understand that. Usually they're embarrassed or they're scared that they did something bad and they're like going to have permanent damage to their penis. So they're really scared. But this is clearly not a believable story. I mean, taking your pants off in a hammock outside and getting honey on yourself, no way. Anyways, let's see what happens.
How did that happen? It's a long story.
Can you see any access to get the catheter in?
No, it's too swollen. It looks like it was mauled by a pissed off badger.
You should have seen it before the IV Benadryl kicked in.
We need to get someone from urology down here now.
Don't you think I tried? There's an emergency and the on-call guy's 20 minutes away.
Dr. Wilson, it feels like I might explode.
I don't think he's gonna last 20 minutes.
Wait.
Dr. Avery, save your breath. There's nothing you could say after this morning to get in my good graces.
I have a giant penis. No, not me. I don't have I'm a girl. I have a patient, and he has a giant penis. It's the biggest one I've ever seen, and I've seen a lot of... You make me nervous. I need a consult.
Better go take a look.
Well, that was awkward. The issue here is that the patient has urinary retention. So he hasn't peed in over a day, and that is extremely uncomfortable. And so the residents are trying to put a catheter in, clearly unsuccessfully, and tried to call a urologist, but the urologist is busy. This can actually be somewhat common because there's usually one urologist covering multiple hospitals, and sometimes you're not available right at the second that you're needed. But typically at one day, lots of patients come in with urinary retention that's been over a day. They're usually okay. You can manage their pain to some degree with pain medication, but they will still be uncomfortable. So it's good that she went to find the urologist, Catherine Avery, who I'm now familiar with. But I realized she's obviously nervous in front of Catherine Avery because earlier in the episode, she was caught making out with her son. So she's nervous around her, but then she clearly doesn't present the patient correctly. So typically what I would have said if I was talking to an attending or a colleague would be, hey, this is an XYZ age male who presents with urinary retention and a swollen penis after bug bites. So that the big issue, which is urinary retention, is front and center. And then I would go on to say that I've tried to place a catheter, I tried to place this size catheter, and I wasn't able to find the urethral meatus, and so I'm having difficulty. So that they know exactly what the issue is, where you had trouble, why you had trouble, because these are all important things that we as urologists use to decide what we need to do next. In this circumstance, I would wonder, well, if she's having trouble finding the meatus, One, we might need to put a suprapubic tube in, or a catheter that goes in through the belly into the bladder directly if I can't get access to the meatus, or try to do it with a cystoscope, which is a camera that allows me to maybe look around and find the meatus inside the swollen penis, or do it under anesthesia. So those would be my 3 options at this point, but let's see what they do.
He woke up, and hornets were stinging him.
Just on his penis, accidentally.
Yeah?
Young man, did you put your penis in a hornet's nest?
No. Maybe. Yes!
Get another 50 fentanyl for the pain. And there's no access for a catheter. You need to go directly into the bladder. Any intern should know that. Just pray we're not too late.
What happens if we are?
Hey, something just happened. I feel like I don't have to pee anymore.
That. The bladder burst is a moment of relief, and then book an OR. Get Dr. Hunt to extend me privileges.
All right, so she did mention talking about a suprapubic tube catheter. I know she's pissed off at the resident, but really there's no reason to berate her. And I really feel like residents are treated sometimes poorly on these shows, but it's really important to treat your residents with some respect. They're all learning, and I wouldn't expect a surgical resident to know to put a suprapubic tube or even how to put a suprapubic tube into a patient. So really, I wouldn't have berated any sort of surgical resident if they called me for help. They did the right thing. Secondly, what happens to this patient is a spontaneous bladder perforation. So this is extremely rare. It's extremely rare, particularly in normal, healthy patients. I've never seen it, and I cannot find a single report of it in the literature. Everyone who's had a spontaneous bladder perforation in the literature has had a history of bladder cancer, a procedure on their bladder, like a transurethral resection or a bladder augmentation, or has a history of diabetes and some sort of bladder necrosis, some sort of crazy setup where that happens. Otherwise, a normal, healthy person will probably be able to retain urine. I've had a patient come in who's retained urine for 3 days or so, and it was very uncomfortable, and their kidneys were affected because of that. So they actually went into kidney failure temporarily because of the obstruction, but that was relieved over a few days after putting a catheter in. So it's extremely rare to have a bladder perforation, but the answer is exactly yes, to take them to the operating room to repair the bladder perforation immediately and do not delay.
Okay, got that closed up. Let me see. Did I miss anything else?
I don't see anything.
That's what's called a rhetorical question, my dear.
All right, take a look at this penis, shall we?
Dr. Avery, can you elaborate on some of your more interesting cases? I'm fascinated by all things penile.
Yes, I saw evidence of that earlier this morning. How's it looking, dear?
Well, it's possible he's gonna need a skin graft, but nothing I can't fix. Yeah, he'll be able to stick it in a hornet's nest, an anthill, tarantulas, wherever they live.
Well, I find that men often put their penises in places that they don't belong. Suction, dear. Come on.
Well, that was awkward. I don't think I'd ever want to be in the OR with my son and his girlfriend after I caught them, making on the call room. That would be super awkward. Hopefully I never have to do that. My sons are still really young. But, it would be very unlikely that somebody who had swelling from multiple bee stings would need a skin graft, in my opinion. But again, I don't know. Obviously, I can't see the patient. There would have to be some real genital skin loss that would require some sort of skin graft if needed. So I think that's probably more to make the awkward scenario between Jackson and I think her name is Stephanie, the resident. But ultimately, what you do in surgery for a spontaneous bladder perforation is you repair the bladder in 2 layers. You make sure the edges are completely clean, meaning there's no tissue that looks unhealthy, and you cut off any unhealthy tissue, and then you close the bladder in 2 layers, and you leave a catheter in as well as a suprapubic tube catheter, which you'll probably leave in for a couple weeks and let things heal up. And the bladder is a very forgiving organ. It does tend to heal very, very well. So this guy will probably do very well.
Oh, sweetie. I'm his wife. I was out of town. What happened?
Well, he came in with quite a few stings in his groin area, and...
Oh, no, he didn't. He stuck his penis in that hornet's nest, didn't he?
You knew. How?
I saw a nest on the eaves as I left. I knew I should have had it removed.
So this is something he's done before.
He's someone who likes a little pain with his pleasure. Any kind of sting, really. Bee, ant. I'm sure he was ashamed. That's why it took him so long to come in. I don't understand it either. But it's just one thing. There are 500 things about him that are so much more interesting.
That is not possible.
So I will say that is the first time I've watched Grey's Anatomy handle a urologic issue with a little bit of grace, which I thought was really nice. So this is not uncommon. People do a lot of things to their genitalia for pleasure that's related to pain, and that is called masochism. So masochism is a term that's defined as people who enjoy their sexual experiences with some combination of pain, loss of control, or humiliation. And it's actually quite common. It has been documented as early as 1500. In the 1800s, you could actually find some written and video documentation of uses of masochism during intercourse. There's a lot of theories as to why people enjoy masochism, but the thought is that it's a release from one sense of self, so they can kind of get away from it all and just focus on the sexual pleasure they're having in front of them rather than thinking about everything else that's going on. It's kind of a way to eliminate any sort of distractions. And that's why the theory is that why people enjoy masochism. And typically people who do enjoy this sort of pain with sex actually have no other psychopathology. So they're not crazy. They don't have other signs or symptoms of instability. They're just normal people who have a certain preference for masochism. There's not a lot about this in the medical literature. There is one paper where they surveyed 1,000 Belgian people and looked at their interest in BDSM, or bondage and discipline, dominance and submission, sadism, and masochism. And what they found was that 47% of people had at least done one form of BDSM ever, and 22 additional percent of people were interested in it. So as you can see, that's actually a large percentage of people who have tried some sort of BDSM. And what does BDSM really entail? That can be actions like being referred to as a title, being tied up, having some sort of submission, so where your partner kneels in front of you, using some sort of, what the word they use is attributes, or using kind of toys or things to augment intercourse. So there's a lot of things that you could imagine that people have at least tried once or twice in their lives, but a lot of people tend to use it usually in practice and enjoy it. So I think that this is totally normal, and we should take away the stigma behind it. People are allowed to have intercourse as long as they're not causing harm to themselves or others in whatever way they prefer. And it's actually been looked at that people who engage in masochism don't actually have any desire to have injury. They just want the pain. They don't want injury or self-harm or harm to their partner. And so they actually practice very safely. It's important for people who are doing things that maybe they're embarrassed by. If you have an issue, please talk about it with your doctor. Don't wait to come to the ER. I've personally seen people put sort of devices around their penis that get stuck, and they wait a long time to come to the ER because they're embarrassed. But don't do that. Come sooner. It makes it easier for us to handle, and less likely that you'll end up needing a procedure or go to the operating room to handle it. And of course, less damage to your penis. Okay guys, thank you so much for watching. I appreciate all your support. Make sure you comment down below. Let me know what you thought of this, and if you have any other topics you want me to cover or episodes you want me to react to, please comment down below, because like I've said before, I do this channel for you, and I want to know what you want to see. So thanks again so much, and always remember to take care of yourself because you're worth it.